Hi, welcome to this afternoon session on SARS-CoV-19 testing. And today I wanted to spend just about 15-20 minutes with you talking about the test types that are available to you, the attributes of each type of test, when you should order a particular type of test, and then how to interpret the results of each type of test. So that's what we're going to spend our day today. We're going to talk about the RNA or molecular test, which is the mucus sample. And that mucus sample is taken and sent to a lab, and they analyze, and then you're going to get a yes or no. So that test is really easy to interpret. You're either infected or you're not. The other type of test is the antibody test, and that's a capillary blood sample test. We require about 4 drops of blood into a sample medium. That sample medium gets sent off to a lab, and then not only do you find out if you're infected, you find out if you're in the beginning or ending phases of the infection, if you have not been exposed, or if you've been previously exposed and you have the immunity or resistance to the COVID-19 virus. Okay, so let's dig in a little bit on these 2 types of tests. The RNA or molecular test. First and foremost, it's the nasopharyngeal probe. That's a little bit of an unpleasant sample. There's a fair amount of skill involved, and so as somebody needs to take that sample, you can't provide your own sample for the RNA or molecular test. And this is the test where you see a lot of people in line, or if you go and you believe you've been exposed or you're symptomatic, this is the test that you want to get, because it will tell you if you're currently infected or not. If you're positive, obviously you have to be quarantined, and if you believe you've been exposed and you have to wait a few days to get tested, you should quarantine yourself during that period as well. Again, the sampling's a little tricky, and then the other variable there is that if you are infected, the presence of the virus waxes and wanes depending on what part of the infection you're in. And so due to the trickiness of the sample taking and the waxing and waning of the presence of the virus, the specificity is a little bit lower than the sensitivity on the RNA test. So if you happen to be infected, but it's a low point in the presence of the virus and maybe the sample's not great, you could get a false negative. Okay, so that's a little concern. It's not a major concern, but it's a small concern. Let's talk about the antibody test now. The antibody test is typically done on non-symptomatic people. It's more of a prophylactic test, or somebody wants to find out, geez, I'm not symptomatic, I would just like to know. And there is a group of people, and it might be as much as 40%. And this group of people have been affected and don't know, and they have some resistance to the virus. And wouldn't it be nice to know that? Because that has implications on some decisions that you might end up making. But in any event, what we're doing with the antibody test is we're going to check the blood sample and see if antibodies are binding to the virus or antigen itself. And so the sample gets sent off to a lab, and we'll talk about the procedure. And you get quite a bit of information. You get, like I think I mentioned, you get if you're infected or not, if you're in the early phases or late phases of the infection, or if you've been previously infected and you're immune. So what I wanted to talk about is the progression of the infection. So there's an initial exposure. So from the moment that you get exposed, there's a period of time where there is not enough virus to be detected. And typically it's 1 to 3 days. In some cases, in some types of tests, it's as much as 5 days. So if you believe you've been exposed, and let's say that you found that out right away, like you went to a party Saturday night, Sunday morning, there's a message saying, hey, listen, I got COVID-19, you should probably go get tested. Okay, so you might want to wait a little bit to get tested. Quarantine yourself vigorously, and then a couple days later, go get tested. And that would be the RNA molecular test, okay? And the reason for that is you want to give time for the test, for the virus to build up to be at a detectable level, okay? So what happens after a few days of the presence of the antigen? Your antibodies start to work, and there's 2 antibodies that we're going to talk about. One is the IgM, which I call the warrior antibody, and this is, initiates the initial battle, and that's the antibody binds to the virus and figures out how to defeat the virus and eliminate the virus from your body. So that goes on for some number of days, 2-3 days. And what happens after a few days of that, the second antibody, the IgG antibody, comes in, and that's the soldier antibody. That's the one that's going to say that it's learned about the virus and then has characteristics that will prevent you from getting reinfected. Okay, and this is how viruses and antibodies work. And this is why when you get a flu shot, we kind of fake the body into producing these antibodies, and they last for about a year. We don't know for this particular SARS-CoV-2 virus how long you have resistance or immunity. It might be shorter, there's some indications it might be shorter. It's not known yet, but we'll find out as time goes on. Okay, so let's talk about the molecular test and how we're detecting the virus. So we're actually looking for the virus on the molecular RNA test, and we're taking that swab is taking a mucus sample, and we're going to extract the RNA material from the mucus, put it in a rich environment for growth, and this process is called polymerase chain reaction, and then we're going to see if we can grow a colony of COVID-19 viruses. If we can grow a colony of COVID-19 viruses from your sample, you're infected. If we can't, you're not. So it's a fairly simple yes or no test outcome, and it's a very reliable test. So the sensitivity is somewhere at 90% with a good sample. The specificity is a little bit lower for the reasons I talked about, but at the end of the day, get a good sample, and you should be very satisfied with the results. Okay, so let's talk about the antibody test or the serology test. So the antibody test, we're not looking for the virus. We're looking for the body's response to the virus. So we're looking for those two antibodies, the IgM initial and then the IgG, the soldier antibody. We're looking for those two. So what we're going to do is take those 4 drops of blood, and we're going to pass that blood over essentially a bead of antigen, and we're going to see if these antibodies bind to the virus. If we can get a detectable level of binding on either the IgM or the IgG antibody, then we can tell you what phase of the infection you're at. Obviously if there's no antibodies binding, then we're pre-infection or you're not infected. And we'll talk about the interpretation of this test in just a second. Okay, so I'm personally like the antibody test for a few reasons. One, it is something that is of a non-urgent nature. So if you, for whatever reason, just want to know, or maybe work is asking you to get tested, or maybe if you're a student at school, they'd like you to get tested, and because you're not symptomatic, they're not able to provide you with the RNA or molecular test, this is an option for you. So a couple things to think about this antibody kit. One, the kit gets sent directly to your house because you can provide your own sample. It comes with a little lancet, it punctures your finger, you put a couple of drops of blood in the sample medium, you close it up, and you're off and running. So the sample taking, it does not take 10 minutes. It's a discrete test, okay? And we'll talk about the HIPAA compliant portal that provides you with your results. It takes 5 to 7 days. So when you are, once you've done this test and you believe you've been exposed, you should quarantine yourself until you get the results. The sensitivity and specificity are around 90%. So the test results are very acceptable, and they're at a very acceptable rate. And I'll tell you another thing, the lab that we use in this method, if they have a phlebotomist take the sample in a very controlled environment, it's 100% accurate. And they use this type of test to compare the accuracy of other types of new types of testing. So it's essentially considered a gold standard. There's no uncomfortable swabs, and the lab is CLIA certified, which most of us don't know, but that is a very high designation and requires quite a bit of procedural compliance to be able to earn that designation. Okay, so if you've decided to get a kit, here's what's going to happen. Included in your kit is going to be a form, and you can fill out that form if you like paper forms, or you can use your phone and take a picture of the QR code, and then that will pull up a form on your phone and you fill it out. The reason I like the QR code is on the form, it's going to have your kit information. So each kit has its own serial number, and that serial number gets tied to you when you fill out this form. Okay, so it's really important. Take a picture of the QR code, fill out the form, do a good job, and it sets up your test sample on the web portal automatically, and it links you to that particular test. So that's the most important thing. Okay. All right. So what's involved with the sample? So first thing is you're going to pick a spot on your finger. You're going to prep your finger. The kit comes with an alcohol prep pad. Clean off your finger. The kit also comes with a lancet, and you're going to get a quick little puncture wound, and then you just kind of let 4 drops of blood fall into this sample medium. And the sample medium comes in a foil pouch. Don't open that pouch until you're going to do your test. If that pouch gets opened and you said, I'm going to go do something, and 30 minutes have passed, you've spent your kit, because that sample medium really does need to be used and closed once the sample is provided in less than 30 minutes. So once you provide the sample, your kit comes with a bunch of stickers of your serial number. You take one of those stickers, you put it on the sealed sample kit, and then the kit also comes with a pouch to ship. Okay, so all this is included in the kit. You put your sample in the kit. If you like to fill out a form and you've filled out that form, you put that in the pouch. If you've done the QR code, there's no need to do that. So that's another advantage to doing the QR code. And you send the kit off. That's it. And then another thing I should mention, in the kit, there's like a little postcard, like, hey, congratulations, you did this. You take one of those stickers I was telling you about. Those stickers have your kit serial number on it, and you put it on your little postcard. At some point in the future, 5 to 7 days, you're going to get an email from the lab saying, log on to the portal and check for your results. And we're going to talk about those results now. There's 4 outcomes. Negative, negative. And remember, we're talking about the 2 antibodies, the IgG, the initial antibody, and the IgM, the second antibody. And if they're both negative, that means that you have not been exposed. It could also mean you've been exposed, but you tested too soon. I shouldn't say it that way. The virus is not at a detectable level yet. Okay, so it's not a given automatic. Because I've heard people say, I thought I got exposed. I did the test the next day, and then a week later I did another test, and the test a week later was positive. And what probably happened there is that the first test, the virus was not at a detectable level yet. Okay, so you have to be aware of that. Next outcome is you're positive for IgG, and that's the warrior. So you're in the middle of an infection. In fact, you're on the front end of the infection. And so clearly you have, this is positive. And so whatever steps you're going to take, obviously you're going to quarantine yourself. You're probably going to want to do some contact tracing, make some awkward phone calls. And from the time that you suspect you were infected until that moment, you need to pretty much call the people that you were in contact with and let them know you've tested positive. Okay? And also, because you're IgG positive and IgM negative, you're in the early part. So you're going to need a full 2 weeks of quarantine or longer. But again, at this point, if you're positive, you should get on the phone with your doctor right away and then follow the direction of what your physician is going to recommend. You're a little farther along in the infection, so that's just some good information to know. Okay, so the last outcome, this is the 4th outcome, and this is to me the most interesting. If you're IgG negative, that means your body's no longer fighting the fight. In fact, it indicates that you've won the fight. You're no longer in an infection. You still could be contagious, probably not. You should definitely call your doctor, say you've been infected. It looks like you have some amount of the soldier antibody, which is kind of the immunity antibody. That's been detected, but the IgG antibody has not. So this is actually some good applications, because if let's say your work is in an environment that might be risky, okay, and there's two people that can do the job. One person has this outcome, and the other person, let's say, has not been exposed. The person who's been exposed and has resistance is probably a better candidate if everything else is equal to do whatever risky tasks that there might be. So, decisions like that, or, even taking it home. Like if you're have to go to the store, and let's say your spouse has not been infected, but you've been infected and you're somewhat immune, and you're looking at each other, well, who's going to go? Well, maybe the person who has some amount of resistance or immunity should go. So, this is how you get information. Okay, so this is what I wanted to talk about today. If you want to get a test, call me. What we're doing right now is we're going to have a really brief conversation. I just want to make sure you understand what you're getting, because I hate to think that there's just a lot of I don't want to use the word hysteria, but there's a lot of misinformation and assumptions being made, and I just want to make sure that you understand clearly what you're going to be getting. So give me a call, and we have a website, yourantibodytest.com. It's really easy to order a test there. And what we're going to do is, if you go to yourantibodytest.com, we're going to ask you a couple quick questions anyway. So we're not going to ship this kit out unless we talk to you real quick. And we're not going to talk to you for a bunch of amount of time. Like I say, because of all the information that's available, I just want to make sure we're clear on that. Or you can send me an email, okay? And the email, I'll get the email. So you can say, hey, listen, I got a question, or I disagree, or this or that, or whatever it might be, or I want to get a kit. Send me an email. I'll be happy to get in contact with you. Okay, thanks, guys. Appreciate it.